I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today, it used to be called alternative healthcare. Alternative meant, something aside from traditional. Well, that term has kind of gone to the wayside, and now it's called complementary. Complementary means everything works together. It's complementing each other. So when it comes to pain management, I'm an expert in pain management. I'm board certified in chiropractic. I'm also board certified in orthopedics. I'm the only chiropractor in the state board certified in pain management, and I'm double board certified in nutrition. So I wanted to talk about complementary treatments to pain management, because sometimes people think it's one or the other. Well, it's chiropractic or it's surgery. Well, there's a lot of things in the middle, and in our office, we incorporate almost all of them except surgery. And I want you to know that these alternatives exist, because that's what this show is all about, teaching you alternative treatments that you didn't even know were there. So if you have chronic pain, many times people look to medicine and surgery, but a lot of people want an alternative. And I think everybody should consider having an alternative to drugs and surgery. It used to be, I've been in practice 36 years. When I first got in practice, anything that wasn't drugs or surgery was scoffed. It's poo-poo, it doesn't work, acupuncture's junk, meditation doesn't work, chiropractic is only cracking backs. Now, they're teaching meditation, how to integrate practices in medical schools now, and they're also teaching it, which I'm happy with, in chiropractic school, in acupuncture school, in massage therapy school, because nobody has all the answers. Chiropractic is the most effective, least expensive treatment for back pain, but doesn't work for everyone. I just had recently exosomes put in my neck, because exosomes are the active part of stem cells. Because I have a crushed disc. I got hit by a car. I've told this story before. When I was 10 years old, crushed my disc. So for 50 years, chiropractic has maintained me and being able to do everything that I do. Now, as I'm getting a little older, I said I'm going to do some interventional medicine because I don't want it to get bad. As we get older, the body is going to start to deteriorate no matter who you are. So I did some interventional medicine with exosomes, billions of exosomes put into my neck. And let me tell you, it's been a great week. I really felt such a difference sleeping through the night, able to turn my head. I used to get little flare-ups and headaches. Almost gone. I'd say 80% gone. So again, chiropractic is wonderful, but then we added the exosomes. You can do PRP. You can do spinal injections. You can do ablations. You can do medicine. So there's so many different things that we can do. So alternative doesn't mean anything anymore. It's all complementary now because we all starting to work together. So you have to do your homework when you're considering things like this, because not every treatment is for everyone. And I'm going to talk about what to look for and what not to look for when it comes to pain management. So make sure you're trying a treatment that's going to work for your case. Chiropractic, in our office, it's the entry level. People come in, we start out with chiropractic evaluation. Most cases, it works. Most effective, least expensive. Let's start there. After a few visits, if we're not seeing the results that we're expecting, and you're not going to be healed in just 2 or 3 visits. I mean, that's not going to happen. But if we're not seeing the progress, and we can feel the joints are more mobile, we can see the muscles are less spasmed. Objectively, we can find things. Subjectively, you might say, hey, Dr. Joe, I'm feeling a little better. If we don't see that, we might want to consider introducing you to our medical division, where we can do nerve blocks, and we can do injections or trigger point therapies, or maybe just some medication to bring the swelling down short term. And then if we need to, we can go into PRP, which we're going to talk about today, exosomes. So we can escalate care. That's what I call it. It's called escalation of care. And we can escalate the care as we go through the treatment to see what's going to work best for you. Because not everything works for everybody. It just is what it is. But in most cases, you want to start out simple. I've had cases every day of my life for 36 years now come in our office, and they went to the extreme first. They went to surgery. They went to injections maybe that weren't necessary. And they've come back and they say, listen, that didn't work. What else can I do? And then I'll say, let's try the basics. And many times the basics work. So you have to do your homework. Acupuncture used to be bizarre. I remember when I was a kid, what, needles in your body? How can that do anything? Rapidly becoming mainstream treatment. Studies have been found that it works for pain and in many conditions like fibromyalgia, osteoarthritis, back injuries, sports injuries. The question I have is, how does it work? And the answer is, nobody's really sure, which is kind of cool. That it's a mystery thing. We will figure it out. It might release pain-numbing chemicals into the body when a needle gets in there, because what we find, too, is when you traumatize the body then heals. So you can do, it's called thumpers, sound waves that you can put into the body, and if you punch the body, sort of, that's what it kind of does, it traumatizes the body, and then the body sends in healing cells. Same concept of exercising. If I lift weights, I'm going to traumatize my muscle, I'll build up more muscle. Traumatize it again, build up more muscle. So acupuncture might work by micro-traumatizing the area and getting in there to help build new tissue. However, it doesn't put the bone back in place. So if a bone is out of place pinching nerves, acupuncture might work as a treatment to manage the pain, but it's not going to put the bone back in place. And that's why chiropractic and acupuncture may be a good combination. Many times you don't need acupuncture if you do the chiropractic. I had acupuncture on my neck. It felt good for a while, but it didn't quite get to the cause of the problem. And so that's okay. I'm not saying it didn't work. It did what it was supposed to do. It was pain management, and it worked really well. Marijuana is something that people come to me a lot with. Now, there's CBD. CBD is cannabinoids that are found in hemp or marijuana plants. Hemp plants are similar to marijuana. They just don't produce something called THC. THC is the hallucinogenic, brain-altering cannabinoid that's found in marijuana. So there is CBD oil that doesn't have THC in it. Some of it does have THC in it. So it really depends on what the issue is. Now, marijuana might help with certain chronic pain patients, absolutely, but there's a lot of downsides to it as well. So the medicinal properties that can help with the marijuana, it's a THC, might work, but you can get addicted to it. Even though people say it's not addicting, it is, because I've had a lot of patients say, listen, I can't not smoke dope. Well, that's an addiction. An addiction, by definition, is something that you're doing that has an adverse effect on your life. So if you're stoned and you can't watch your children, if you can't drive, well, it's an adverse effect. And if you can't stop doing it, well, then it can be an addiction. Now, there has been studies shown, and again, I'm not against marijuana. I'm just giving you the pros and the cons here. So don't send me emails and say, you don't like marijuana. I didn't say that. What I said was there's pros and cons here. It may help certain type of nerve pain, like with multiple sclerosis or HIV. There's been some studies done on that. People suffering the side effects of chemotherapy because it can help with nausea. It can make you hungry, munchies. And so sometimes after chemotherapy, patients don't have their appetite and they lose a lot of weight. And so marijuana might help in that area as well. The risks. Risks are that it can include addiction. It can include psychosis. You can get paranoid. Okay, if you were young enough to remember the days, well, I guess it's more popular now than ever. I shouldn't say popular, it's more used now than ever. But you get paranoid. And so that's an issue that we have to be careful with. Dangers, potential abuse. So I only recommend turning to that if you absolutely positively have to. I know there are some states that legalize it. If you want to legalize it, that's fine with me. This is not a political show. But I have had friends go there just because they can smoke pot. And it wasn't for medicinal reason. They just want to smoke pot. So I'm kind of on the fence on that one there. If it's necessary, absolutely, I think it's a good idea. On a practical level, you have to be aware of your state's laws. If you interject marijuana into your lifestyle and it's illegal, you can go to jail. And I don't want you doing that. So be careful. Don't think you're going to go into another state and say, oh, it's legal here. I'm going to load up on the marijuana gummy bears and some joints and bring it back to my home state. If you get caught, like in Georgia here, it's illegal, you will get arrested. You will go to jail. So whether you need it, I understand it works on certain cases, but do understand that there is that political aspect too. And again, this is not a political show, just making some points here. Chemotherapy, it seems to work real well with certain people like that. Absolutely. I think it's a wonderful thing, but it's just like alcohol. Just because it's legal doesn't mean it's good for you. And if it's necessary, that's one thing. But if it's not necessary, I'd be careful. So what we're talking about today are complementary treatments for pain management. And there's a lot of things out there that a lot of people don't even think about. Exercise, I know that's really not considered a complementary treatment, but exercise can work really well. I want to get the body in motion. Your body is designed to be in motion. And if the body's not in motion, muscles get weak, joints get lax, they become weak, and the bones can move out of place. So staying in motion is the key. In fact, I was just talking to one of my doctors, Dr. Kat, and she's in great shape, but she joined a walking group. And she says, if I'm not working, I'm walking. And now she's in amazing shape, and she's like struggling to get out of the chair, and she strained herself a little bit too much. But in a case like that, what do? Number one treatment would be chiropractic care. So she came in, she got adjusted, and she felt better. So if you have pain, you always want to think, first thing I think is, what's causing the pain? Is it a bone out of place pinching a nerve? If it is, it's a chiropractic case. Is it a spasm muscle? Probably a chiropractic case. If it's a cancer or a tumor, well, we may have to use other intervention for something like that. So that's why it's so important to have somebody who can diagnose your issues. And understand something. Every diagnosis you get from a doctor is what we call a working diagnosis or differential diagnosis. We think it's this. It can change as we find out more about the patient. We may come in and say, okay, you were in a car accident and you need chiropractic care. And then we do a MRI or a motion MRI study and we see that the ligaments are torn. All right, maybe now we need some intervention. Maybe we need some PRP. Maybe we need some exosomes to try to get those ligaments to heal. Maybe we need a pain injection into the facet to calm it down so we can go ahead and do the adjustments. So there is no cut and dry answer when it comes to pain management. That's why it's important you find doctors who understand there's other things out there. You might have heard the phrase, if you're a hammer, everything you see is a nail. If you're a barber, everybody needs a haircut. Well, if you're a chiropractor, everybody needs an adjustment. If you're a surgeon, everybody needs surgery. Not always. There are times we need to do interventional medicine and try to find out what we can do to get the body fixed. So exercise can relieve chronic pain, can boost energy, can boost mood. It releases endorphins into your brain. Endorphins are like painkillers that are 16 times more powerful than morphine. So that's why we like pleasure. And we talk a lot about diet on this show. Today, we're not going to talk that much about diet. But if you're eating sugar, it releases dopamine in your brain. Dopamine gives you pleasure. What do you want to do? You want to have more sugar. And so there comes a point, too, with dopamine release that it can be too much. I've had patients that exercise too much, and that causes damage to their body. The number one treatment, of course, I got to talk about is chiropractic. It's the most effective, least expensive treatment for back pain. And the way chiropractic works is really cool. The way the body works is your brain sends messages down your spine, out your nerves to every cell in the body. So right now, your brain is telling your heart to beat, your lungs to breathe, your colon to digest food, your toenails to grow. Everything is hardwired to the brain by way of a nerve. Two things can interfere with the flow of energy. And I tell every one of my patients the same story. So when you come in as a patient, I'll tell this to you again. Chemically, we can alter a nerve or physically. Now, chemically would be food, drugs, alcohol, environmental toxins. So that's why in our offices, every patient gets a nutritional workup. Nobody else does that I know of in a pain management setting. I think we're maybe the only ones in the country as far as I know. So we do a nutritional evaluation because you may be having headaches that's caused by artificial sweetener. Well, I can give you the best chiropractic care and the best PRP and the best injections and the best pain management. You got to stop drinking artificial sweetener. And right, no drug in the world that's going to work as good as you stopping the artificial sweetener. So at our offices, we do the nutritional evaluation as part of our pain management and our wellness protocol. And that really what separates us from, as far as I know, other doctors all across the country. So that's why people come to us from all over the country. So chemically, it's an issue. Or physically, if a bone moves out of place, it can pinch a nerve. And if you pinch a nerve, it hurts. But here's the thing. 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. So that's why in our offices, we want to check the nerves that feel pain and we check the nerves that don't feel pain. And if bones are out of alignment, they rub up against each other and they wear out. How often? 100% of the time. That's osteoarthritis. And so if you have bones out of place, you definitely want to get them put back in place. My team of doctors are experts in bone setting, putting the bones back in place. And the reason I know that is they're all my doctors. If I don't trust them taking care of me and my family and friends, I don't trust them taking care of you. So when you come in our offices, you are in the hands of who I feel, my opinion, some of the best doctors in the world. And there are many doctors I've turned away. A lot of doctors want to work here. Chiropractic, medical, won't hire them. I just had a guy last week. Twice he ghosted me. And then we set up an interview. He didn't show up. Then he called me, he sent me an email that afternoon. Hey, I want to come in for an interview. I couldn't make it this morning. Too late. Don't stiff me, man. This is a serious place. This is not a game. So my doctors, I'm on them constantly to make sure they're constantly improving their skills and techniques, myself included, so we can give you better services. If the joints are wearing out, if there's muscle tears, if ligament tears, we might want to consider something called PRP. It's called platelet-rich plasma, and we take your own blood and concentrate out the bioactive part of it called platelets. Now, we used to think that platelets did one thing, and that was just clot blood. Well, it turns out platelets have so many components to them that can actually stimulate healing. It's minimally invasive, minimal downtime. In fact, I've had injections already. You're done. It's like you're on your way. It's like nothing. Speeds up and promotes healing. It's your own body cells. So we're not taking cells from a baby or a transplant. We're taking your own body cells and putting it right back in your body so there's no rejection. And less side effects when compared to things like injections and surgeries. So a lot of people are turning to PRP because it's so effective, way less expensive than most other treatments, and it's your own body cells. And that's why it's become so popular. So platelets in your body, they're considered concentrated when they're at least 4 times your regular platelet level. So we can take your blood out and spin it down till it's 4 times minimum its concentration level, and then we can put it back into the body. It can go as high as 6 times, 12 times, even 18 times the concentration. But here's the thing with concentration, more is not always better because sometimes it has a reverse effect and then it starts to be less effective. So it's important you get somebody who knows how to do the PRP injections, and our medical staff is very well trained in it. And platelet-rich plasma is the cell components, and when properly prepared, really can help facilitate and heal the injuries of the body. It's biological. It's really the cornerstone of what we call regenerative medicine. And the healing process works like this. We'll inject you with PRP or exosomes, and some doctors may even use stem cells. Got to make sure you get only quality stem cells, and that's the big thing in the stem cell world, is that so many times you're getting junk stem cells. So that's why I'm not the biggest fan of stem cells. I have a new company I'm looking at. They might be able to prove to me that they have good quality products. You put it in, it heals for about 4 to 6 weeks. So it doesn't happen right away. You may have an anti-inflammatory reaction right away like I did, but you have 4 to 6 weeks of the body continue to heal, which is really cool. So you're not going to see all the results for 4 to 6 weeks. And that's why it's so popular. And many times it's an alternative to surgery, and it's alternative to injections and pain management because it's your own cells. And I like that. If I put steroids in your body, and I'm not against steroids, if I put steroids in your body, it can weaken the immune system. This will not weaken the immune system. In fact, there's early studies out now that it may actually enhance the immune system. Okay, even if it does nothing, it's not going to weaken the immune system. So PRP, we have it on our office, and all the services we offer on our website, drjoe.com. So if you go to the website, drjoe.com, there's a little tab on the top of the website. It says services. Look at everything that we offer. Chiropractic, PRP, pain management, injections, nutrition, dietary workups, supplements, testing, lab testing for micronutrients, hair analysis for heavy metals. We really, truly are a wellness center. And when you come in, we try to find the best treatments that are going to match your specific needs. And it works really well. I mean, most of our doctors are booked solid. So if you do want to make an appointment, you can do it. You want to do it soon, as a matter of fact, because my doctors book up quickly. drjoe.com, you could book it right online, or you can call us. The number's on the website. And initially, the first visit was $375. That's an exam, x-rays, consultation, your first chiropractic adjustment, going over the x-rays on the next visit, and a nutrition evaluation. We've reduced that price to $199. So if you want to do that, do it soon. And we do accept insurances. If you've ever been in a car accident, people, please, if the car was damaged, you were damaged. You need to get to see us right away. I promise you, if the car was damaged, I've never seen where it wasn't. So car accidents, sports injuries, pain management, nutrition, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We're talking about complementary control of pain today. Supplements, really important. Omega-3 fatty acids, I take them every day. Excellent for anti-inflammatory reactions, bringing down the swelling, and it works real well for brain function as well. I take them every day. We have a topical CBD cream, and CBD is very popular. I like it if it's a good quality product. One of my doctors just said she gave it to one of her friend's mothers who's in severe pain. She can't get out of the house. She loves it. So the CBD cream works very, very well. CBD gets into what's called the cannabinoid system in the body and can actually help control pain and mood swings and, does so many different things. So a CBD cream is on the website. I like it too. It's my favorite. I've tried many. It's by far my favorite. Nitric oxide. Number 3 most popular supplement we have. The most popular supplements we have are Super Greens and Essential Source. This is the core of a nutritional protocol. If you're serious about wanting to get well, I start everybody on Super Greens and Essential Source. You can order them on our website. We'll ship them to you, or you can pick them up in any of our offices, Marietta, Duluth, Stockbridge, and West Cobb. Then nitric oxide. Nitric oxide opens up your blood vessels. I love this supplement. I take 2 in the morning to start my day. And then if I have a busy day or if I have an exciting night planned, I'll take another one in the afternoon. Gives you a ton of energy. It increases circulation to your brain, increases circulation to your reproductive organs, trying to keep it clean. It's a family show. But boy, let me tell you, Super Greens, Essential Source, and nitric oxide, bam, you'll most likely feel great. B vitamins are necessary for nerve function. We have turmeric on there. Turmeric is an anti-inflammatory. So when I put a pain protocol together, Super Greens, Essential Source, nitric oxide, B complex, and turmeric, and omega-3s. That helps control the pain. So that's a natural protocol. I take it every day, even if you're not in pain. Those are really good things to add to your diet. Plus a good diet, of course. You can't, I said the other day on the show, you can't outrun your fork. Okay, you can work out all day and you can take the best supplements in the world, but you need to do dietary changes too. And if you go to our website, drjoe.com, we have tons of information on dietary stuff. I'd say start with the show we did called 7 Deadly Sins of Nutrition. And the follow-up show I want you to listen to is So What Can I Eat? So 7 Deadly Sins of Nutrition, So What Can I Eat? That's your starting point for learning how to change your diet. Whatever topic you're looking for, type it in the website. Chances are we've done a show on it. Just type it in the search bar. If you're a podcast fan, just go to your favorite podcast service and type in Dr. Joe for the Health of It. Dr. Joe for the Health of It, and our podcasts are on all the major podcast servers, and you can listen to Dr. Joe 24 hours a day if you'd like. Our website, by the way, has over 1,500 hours of podcasts too. So drjoe.com, Dr. Joe for the Health of It, your podcast services. You can do that. We talked about making a new appointment. That's great. The supplements, like I said, you can get them at our offices or online. And I want you to follow us on social media. We post every single day, health tips, fun facts, dietary tips, sometimes recipes. Our handle is at Dr. Joe Esposito. So do it right now. At Dr. Joe Esposito, type it in and follow us on social media, Facebook, Instagram, and YouTube. Many times when it comes to pain management, you have to look at digestive issues. If you're not breaking down your food properly, you're not absorbing your nutrients. And I cannot tell you how many pain doctors around the world have sent patients to us for chiropractic evaluation and nutrition evaluation. And we get their diet straightened out, and they stop doing the things that are causing the pain. And we get them on a diet that brings down the inflammation, helps control the pain. And the biggest complaint I get, every day I get it, why didn't I do this sooner? It was just that simple. And the answer is yes, it's just that. Not in all cases. In most cases, it's just that simple. So if you're serious about wanting to get well, go to the website, drjoe.com, and you can book an appointment to see us. You can listen to the podcast. You can send me questions through the website. Me or Garrett or Joe are more than happy to answer your questions. We want to be your doctors. We want to get you well and keep you well. So make your appointment right now, drjoe.com, and get your supplements, drjoe.com as well. You also might want to consider things like massage. Our West Cobb office, we have an unbelievable massage therapist, Jo Elise Martini. She is off the chart amazing. You can book her right online through our West Cobb office, and you can book massage as well. So when you want to look at a pain management protocol, chiropractic, nutrition, get the digestive system working so you can absorb nutrients, massage, we can add CBD oil to that, CBD creams. We can escalate it to PRP. We can do pain injections. So in most cases, you shouldn't be suffering, or you're suffering needlessly. And that's why in our office, we're really good at managing pain cases. And that's why even surgeons and hospitals and insurance companies will send patients to us because they know that it's the most effective, least expensive treatment in most cases for pain management. So folks, I'm Dr. Joe Esposito. If you want to make an appointment, drjoe.com. Any questions, send them to me through the website, drjoe.com. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.